Welcome to Practical Talk Time. I'm Sandy Wrobel, your host for this evening's call-in show. We have with us Dr. Ken Hoffman. He's the director for Integrative Medicine here in Brookfield, Connecticut, and he's a wealth of information. He's also an author of a book, or part of a book. There's several chapters. He's the author of one of them, and we'll be discussing what it is that he does with acupuncture and several other methods. And don't hesitate to call in, even when we're speaking. It is your show for you to call in and get information. And it can be any type of health problem. It doesn't have to be what we're currently speaking about on the air. And the number will be, or is, 203-792-4101. Welcome to the show, Dr. Hoffman.
Well, thank you for having me. Thank you.
Oh, it's our privilege to have you here.
Yeah.
And this is very exciting because you're in a field that is an alternative or a holistic method of medicine.
That's right.
It's not the traditional method that we're used to.
That's right.
And in the past, I've tried, I've gone to naturopathic doctors and chiropractors and so forth. And I have had some acupuncture done prior to the time I met you. And we'd like to know some of your background. I found out about you from listening to the radio program.
That's right, the Natural Medicine Connection, my show on WLAD. Yes, I'm very excited to be here, thanks. And you know, I'm a doctor of acupuncture in Rhode Island, but not in Connecticut. It's funny how the laws work, but you know, yes, I've had my practice for about 10 years. And I actually started in medicine and in Chinese medicine about 20 years ago. I was fortunate enough to meet a Chinese medical master who took me under his wing and started to teach me this medicine. I first started learning Qigong and martial arts and all of that, and also he would bring me down to Chinatown where we would go to the herb shops and he would teach me about the Chinese herbs.
In
all
New York City?
Yeah, in New York City. That culminated in, after about 5 years of study, where I actually went to Taiwan and studied as well. So I've been able to see the medicine from both sides. I've been able to see it practiced as it is in Asia. And then I've also, part of my background was before I got into this medicine, I actually worked as in emergency medicine as a first responder. And I also spent 3 years working in a psychiatric institution as a counselor in training. So I've been able to see both Western side of the medicine and both Eastern medicine. And they're very different in their approaches, but they have something beneficial to offer to each other. My particular purpose is that I want to help people get well naturally without drugs and surgery.
Yes.
So, you know, that's kind of where my background led me to, is where I saw what happened in Western medicine. For example, in the hospitals, I felt that what was happening was they were really treating the symptoms, and yet they had a lot to offer through the science. From the Eastern side, I know that what we were doing was looking at root cause. We were looking at the basic underlying function of the human frame, and that's the way Asian medicine was actually, how it actually evolved, because it was the medicine for the emperors, and it was to prevent disease, and it was to keep them healthy. So what happened is, over time, I took my experiences from both Eastern medicine and Western medicine, and I blended them to get together in my practice. Which I opened 10 years ago, and since then have been able to really, I think in the time I've been in practice, I've treated about 18,000 treatments with acupuncture and Oriental medicine. I've seen about 8,000 patients. We're one of the busiest practices in Connecticut right now in integrative medicine, and it's just been a great journey so far, and you know, being here is part of that journey.
I think many people are looking today for alternative medicines because we read about so many side effects of medications, and sometimes they are necessary.
Sometimes.
And also, as you said, there's a place for everything.
Right.
I know that the naturopathic doctor I go to had said we would have a perfect system if they had allowed both to develop way back when.
I agree.
But the big money went into the allopathic medicines.
Well, that's a whole show in and of itself. But you know, the fact is it's absolutely true. What I find is that when we start to look at the root cause of why somebody's not feeling well or doing well, or we start asking the questions. For example, on my radio show last week, we were talking all about hypertension. You know, when we start asking why somebody has high blood pressure, when we start asking why they have high cholesterol, what we find is that it's not a it's not a reduction in medication as much as it is something that's going on in their body, that their body's not functioning the way it should. And when we find out what that why is, which is what we specialize in our office in doing, is finding out root cause, then we can correct it using things like acupuncture and herbals and supplementation, diet and lifestyle changes. When you do all of those things, it's many times that you can either help the patient reduce their need for medication or eliminate it altogether. So what I find is when the body is functioning optimally, there's no need for medication. If it's not functioning, if you do everything you can do, and at that point you still can't, let's say, get their blood pressure down, then yes, maybe they need the use of medication. That's certainly for the patient and their doctor to choose. But in my opinion, I think that medications are being overused and they're being quickly prescribed because it's easy and simple, rather than making changes in your life that could have a profound effect on your long-term health.
Right, I know I'm retired now, but I did
Right.
teach school. When I first started, it would be very rare that children had any type of medication. It might be for a week or so they had to go to the nurse's office. By the time I retired, they were huge trays filled with Ritalin.
Wow.
And kids would be lined up out the door because they'd
That's
have to
right.
get it from the nurse, and she'd be signing their name that
Right.
they received it and everything. And I always thought, I can't believe that many children, so many years later, all of a sudden,
Right.
where is this coming from?
And the irony of this is that there's been 35 years of research, 35 years of research that shows that attention problems in children, things like depression, things like anxiety, are caused by food allergies, chemical sensitivities, and food sensitivities. I mean, the research is done on all this. It's been there, but it's being ignored, and it's unfortunate. So, what we're trying to do is not only in my practice, and what my goal in life really is not just to treat people, not just to give them herbs or supplements or acupuncture, but to actually educate my patients so that they understand what's going on with their health, and they're understanding some of these things that's just not being talked about.
So in your practice, if you're prescribing herbs for someone, the intent is not that they would have to take that herb for the rest of their life.
No, not at all. In fact, Chinese medicine is corrective in nature, meaning that the inherent wisdom of these herbal formulas, which, by the way, some of the formulas we use are more than 900 years old. I mean, these formulas have been written about in compendiums of medicine that has been around in the Chinese medical system for thousands of years. And some of the formulas that we're using are extensively studied, but they're also, again, they're about 900 to 1,000 years old, and they have profound effects at changing the physiology of the body in such a way that these conditions don't come back. Here's a good example. I had a patient that went to their doctor for a routine physical, and their blood pressure was high. And rather than go on the medication, she came to me and wanted to get some care. So, I worked everything up, and we worked with her, and I'd known her before. I treated her for some arthritis she had, which disappeared, by the way. And I worked with her on her blood pressure. And we got her blood pressure down naturally with some of the Chinese herbals. And 6 weeks later, she went back to her doctor. The blood pressure was normal. And I saw her about 6 months later, and I said, "How's your blood pressure?" She said, "It's great." I said, "Well, I noticed that you haven't been ordering any of the herbs from us." She goes, "Well, I've only been taking it once a week, and my blood pressure seems to stay normal." So it's very interesting, I think, that the inherent power of these herbs and some of these ancient herbal formulas, not only do they have specific Western modern physiologic effects, but they also have the inherent nature of being able to correct the body where it's out of balance. So it's pretty neat.
Right, because they say the body really can heal itself.
That's the underlying premise of my belief in medicine, is that the body does heal itself. And if I didn't believe that, what I would do wouldn't work.
Right, and I think that before you had this practice, I understand that you also had a school for martial arts.
Yes, I actually, right here in Bethel, I owned Karate America for 16 years. And in that time, what happened was I started out very young. It was about that time that I met this teacher who was teaching me the medicine, and so I trained in the martial arts, and I had a very busy, big school here in town. The thing I loved about what I did there is my philosophy about studying martial arts was very different than most. It wasn't about fighting. It was about self-evolution. It was about evolving as a human being and learning to cope with life's challenges. And my school became very well known for that. It became well known that you would come there not to learn to be a fighter, but you would learn there to learn the arts. And so yes, for 16 years I did that. I sold it to one of my senior students when I went back to Chinese medical school. And it's still here today. So,
oh, it is?
Yeah, it's still here. I think their philosophy has changed a bit, but yeah, that's been a big part of my growth. There's a philosophy in martial arts. It says that if you learn to hurt, you have to learn to heal. That's the yin and yang of life. And so that's why my teacher felt it was very important to teach me how to heal others. And it has become a huge part of my practice, because when I do a treatment, for example, an acupuncture treatment on somebody, it's not about sticking a needle in a specific place. That's one piece of it. That's actually the Western part of it. These acupuncture needles are the size of the tip of a pen. So you have to know specifically, very, very focused on where that's going to go. However, the part or component of it that you can't teach is the art of it, which is that you have to be fully present. You have to be fully anchored in what you do when you do that treatment. And that's the part that, unlike most acupuncturists, because I had 16 years studying these esoteric arts, I'm able to put that into my treatment. So it's become a huge component of who I am and how I get results.
So do you do something like meditating before you do your practice? Or is there like a ritual you go through that we wouldn't even know about?
It's really funny. It's actually, there was a saying about that, if you've ever heard of Morihei Ueshiba, he was the founder of Aikido. And when he was 90 years old, he could actually go out and best, men that were 20 and 30 years old. And one person said to him, Master Ueshiba, how come we never see you get pushed off balance? He said, I do, but I adapt so quickly you don't notice it. See, that's what I do in my practice. Is I don't necessarily need a ritual anymore. What happens is when I walk into the room with a patient, my demeanor goes right down into my center. It's the actual treatment itself that is my meditation. So that the needle becomes the sword, if you will. So that for me, it's just after a while, it's become a reflexive reaction to get centered when I treat somebody. And that's also because you need to be centered when you're feeling the pulses. That to truly practice Chinese medicine, you have to be able to feel the 29 different pulse qualities, as well as look at the tongue and know all of the different nine or more basic patterns of how the tongue looks and observe these things. So when I go in with a patient, the other thing that I do is, and I guess maybe that's part of my meditation, is as you know, I shake the person's hand. People think I'm just greeting them, but what I'm doing is connecting with the person. And then I'm feeling their pulse, and when I feel the pulse, I'm quiet. And I can feel what's going on in the body through the pulse. And that's why we can check things like looking at how the heart's functioning, or how the hormones are working, or any part of the body, and whether the person got any sleep that night, or whether they're whatever it is I can feel that in the pulse. But when I'm doing that, it centers me, because it's a very quiet connection with that person. So I think if I was to pick anything, it's funny you asked that, because nobody's ever asked me that before, but I think that it's actually when I center on that person is when I get into my zone, if you will.
I don't know if there was research done on it, but I know when I was teaching, I think it was Taekwondo, some of the boys would take, and some of them were like, not really bad, but behavioral problems.
Right.
And they would have a sheet of paper that they'd have to sign off, how they behaved that week in school. And I thought, well, I don't know if it's a bunch of baloney or whatever, but I really have to say, it's not research, it's just my observation.
That's okay.
That the ones that did do that, they really did improve. There was like more self-control and
yeah, there's something, there's a theory that things like ADHD has to do with people not being able to be in the present moment. And all we have to do is look around us at the number of car accidents and injuries that happen in our world. People are not present. They're on their cell phones, they're doing whatever. The key, I think, is to bring people into the present moment. Whatever you're doing, you should be doing it. And I learned that from my martial arts training. So when I'm in treatment mode and I'm treating patients, I'm treating, and that's what I want to do. And it gets me focused, because I want to be in that present moment. And it's very important. It's very important for people's health too, because I think that our bodies have a way of telling us when we're not in present moment. And that is that we start to get health problems. And part of that is how we assess people. Is one of the things for self-assessment that we talked about before the show is these 15 markers of health. this self-assessment is being in the present moment. And in my book, I write about the 15 markers of health, which is most people don't even know what being healthy really is. The fact is that, for example, symptoms. Many people think that if they a simple symptom like having a chronic backache is just something that comes with age. But the reality is that in many cases, it's your body telling you that something's going on that needs to be checked out. Mm-hmm. And I think if people would be in the present moment with what they do, they would actually notice these things more and notice it earlier and be able to prevent these things from becoming chronic arthritis or spinal stenosis or depression or anxiety.
Right, and usually if I have something wrong, you think, well, you just wait and it'll probably go away.
Yeah, but that's what most people think, I know.
Right, until it gets more severe.
Yeah, and that's kind of the American method. That's the American mode. Part of our educational component, which is something that we do as well as you went through in our first few visits. Our goal is really to do education too. We have some PowerPoints. We try and educate people on, why that isn't the best way to be healthy. And the reason for that is because our bodies tell us that something is going wrong well before it becomes a disease. And that's the function. It's a lot easier to change the body when there's a functional issue than it is when it's a chronic, entrenched disease. Mm-hmm. And I'm really trying desperately through my radio show, through my book chapter, through shows like this, through my education with my patients, is to share with people that if you really want to be healthy, or if you really want to preserve your health long term, we have to start looking at and assessing our bodies well before it becomes a disease process. So that's what my goal is. My goal is to be able to do that.
Oh, we have a call.
Oh.
Welcome to Practical Talk Time. Do you have a question for Dr. Ken?
Yes, I wanted to ask him, how much is too much working out? Like when I go to the gym, I like to go every day. Mm-hmm. I just want to make sure I'm not overdoing it. Does he have a better idea?
That is a great question. Thanks for calling. That's actually a great idea. Chinese medicine is about balance. It's about balance. I believe that the kind of a marker for you would be if you feel that your body is recovered within 24 hours, meaning that if you work out hard and you're sore and you're exhausted, your body should recover within 24 hours. If it hasn't and you're going back into the gym and you're still sore and you're still achy, it means that you may be overdoing it. So you have to you have to assess yourself that way.
So when you're building muscle, you should really take your time, right?
Oh, absolutely.
Would it upset me that my wife wants to have sex with me every single time I come home from the gym?
What's that?
I said, should it upset me if my wife wants to have sex with me every time I come home from the gym? That's probably why I can't get the rest.
Well, you probably want to get, that because, Chinese medicine has a theory on that as well. They say that too much sexual activity will actually deplete something called your jing, or your ancestral energy. So that's for men that's too much. So the fact is that ultimately I think life is about balance, and that exercise should be modulated. My suggestion to you with exercise would be exercise 4 days a week, 5 days a week with a stronger exercise, and on those other days, maybe those 3 days or so, what you want to do is something more calming, like yoga, like Tai Chi, or something like that moves the body more gently. That's going to be a much more balanced approach. Most people look at physical exercise, and we think more physical exercise is better, but the fact is that what we have to do is balance it with some of these more gentle, circulatory moving exercises. That's very important as well. But the key really is movement. There's a very interesting study that was done on this, and this study looked at people who were sedentary, who exercised 1 hour a week. What they found was for every hour that we sat sitting on our butt during the day, for every extra hour that we did, we increased our chances of disability by 50%. Meaning that what we need to do is the human body was actually designed to move. So the goal in life should be keep the body moving, but at the same time, you don't want to be aggressively pushing and driving the body so that your body's not recovering from the activities that you're doing. Hopefully that answers.
I've obviously been overdoing it then, so I am going to take your advice and try to slow down now. But should I let my wife have sex with me before or after I go to the gym?
That would probably be.
If I masturbate.
Well, this would probably be a conversation that we might want to have outside of here, as to what activities that are. But if you're pushing yourself in the gym and pushing yourself in the bedroom,
I'm sorry. I jerk off so much. It makes
Okay, thank you for calling.
Thanks for calling. There you go.
We've never had a call like that before.
Oh, okay.
Well, anyway, that was an interesting call.
Well, but it brings up good points
Yes.
about overactivity. I think he was probably looking to get some airtime, but it's, with that. But, to answer that question is the best thing you can do is life is about balance. It's about balance of 3 different activities. It's the balance of proper diet, proper rest, and proper exercise. And if you balance those things in your life, those are part of the 6 there are 3 of the 6 dynamics that I talk about in health and longevity, is that you want to balance these. These are the things the patients do. So proper exercise is just what I talked about with this gentleman, which is, if you're going to work out, don't overdo it, but keep your body moving. The goal is circulation. Keep the body moving, the circulation moving. With proper rest, we also need to balance it with that. Is every day we should have some time in which we allow ourselves to settle and calm, whether you call it meditation or relaxation or whatever it is we've got to let our mind settle. We've got to be in present moment, and that means sometimes just sitting and not doing. It means sitting and having a cup of tea and staring off and allowing our thoughts to settle. And then the last thing is diet. And diet's the thing that's more controversial because there's a lot of different diets out there. But I think it's got to stay simple. And I think that the proper diet is one, for example, in Chinese medicine, the diet is customized per person. So meaning that depending on your pattern diagnosis, the diet could be different.
That would make more sense to me.
Absolutely.
Because people go on diets and then there's always the controversy, well, it works for me. And I know Weight Watchers was supposed to be so wonderful. And I had horrible results trying that.
Right.
And I think not enough is known, or maybe with the Chinese way where you're looking for the root causes.
Right.
If you're talking about the hormones or other things going on in the digestive system.
Well, in Chinese medicine, what we do is we actually assess the different organs and the organ function. So, for example, if there is, let's say that the liver is stagnated, meaning that there's some blockage in the liver and the circulation is not moving through the liver, what we may prescribe to that person is that they eat foods that are more bitter, or maybe even have a half a cup of organic coffee every day, because bitter is the taste or function of moving stagnation in the liver. So we might do something like that. If somebody has a spleen qi deficiency, let's say, and they tend to generate dampness in their body, then we may recommend that they don't have a lot of cheese or dairy or fatty, greasy foods in their diet, and that they eat foods that are going to be more draining, like certain types of barleys or certain types of herbs that might actually help to move dampness out of their body. So it really depends on the person. The diet is customized based on whatever their pattern is.
So someone might be told to eat cheese and someone else might be told not to eat it.
Well, I don't recommend cheese anyway, but that was.
Oh,
just
you
an
don't?
example.
Why not?
No. Well, I think dairy in general is not great. The American diet is very what we call damp. A damp diet is one that generates a lot of fluid retention. It generates, obesity. It generates fat tissue. It generates congestion. And those foods in particular are things like dairy and cheese and saturated fats and those types of things. Chinese medicine believes that too much dampness actually damages the digestive function of the body. I'm not a big fan of dairy in general. And this is I mostly because I think that dairy is not what it used to be 100 years ago. There's a lot of problems with dairy that are causing and affecting things like food allergies, attention problems, et cetera, et cetera. Dairy, back 100 years ago, the milk was raw. There were certain bacteria, there were certain nutrients in the milk that really actually helped our health. And people didn't drink it all day long or drink gallons of it like they do today. Now what's happened is through the homogenization and the pasteurization, which, what homogenization does is takes the proteins and the fats of the milk and smashes them together so that they bind. That's why when you buy milk today, the cream doesn't rise to the top anymore.
Oh, when I was a kid, there was little ladles in the bottle, and my mother would take the cream off, and they could make whipped cream or whatever.
Yeah, that's
or you shook the bottle up.
That's your homogenization process. That's a new product to the human health. Our digestive tract has no idea what to do with that, so it treats it like an allergy. The second component of that is the pasteurization process kills any bacteria within it. So basically what you've done is through pasteurization and homogenization, and then let's put on top of it that 100 years ago, the average dairy cow would produce maybe 1,000 gallons of milk a year. Today, it's over 50,000. And that's from the use of, you know, how do they get a cow to produce that much in commercial? Is through hormones and through growth hormones and all this other stuff that they're giving them, and antibiotics. So what's happened is milk has actually become a damaged product, in my opinion. And the human body is not designed really to handle it. So I'm not a big fan of recommending milk. There's a lot of ways to get calcium. One of the statistics that might actually surprise, you know, some of the viewers out there is that America has the highest intake of dairy in the world, and yet we have the highest incidences of osteoporosis in the world. So this whole bill of goods that we've been sold about how dairy is a good source of calcium and builds strong teeth and bones was actually a good lobbying effort by the American Dairy Association, but it's not necessarily panning out to be true.
Oh, that's very interesting.
Yeah. Now, one.
And at least you explain why, because I know some people are against dairy. They really don't want to be using it. But to me, it seemed like a fad because there was no reasoning behind it.
No, there's a reason behind it.
But some milks now do say that there's no hormones and so forth.
They're jumping on that, and that's better. You know, an organic, hormone-free, antibiotic-free milk is better, but they've still kind of killed anything good in it. Now, up in New York State, where I have a piece of property, we actually buy raw milk, and it's actually quite fun because, but it's a lot less expensive than down here. So I don't buy it down here. But it's nice because what I do is teach my kids how this actually comes. They go to the farm, they see where it comes from, and actually gross them out a little bit.
I used to, when I was a kid, we used to go to Gonzowski's farm, and
that's right.
There was a big
jug, right?
Yes, a metal jug, and a strainer, and then the cats would come around because the top was
open.
What didn't go through the strainer. The top of the strainer
and for some
was given to the cats.
And surprisingly, with it being like that, nobody died from this. Isn't that interesting?
It's amazing we lived this.
Nobody did. Yeah,
yes,
we
survived.
You know, but what they've done is been able to do, like, for example, my kids, we make butter. We make butter out of the raw milk, and then we use the buttermilk for, you know, making foods and stuff. My son actually likes buttermilk, so I let him drink a little bit of it. However, again, constitutionally, if you tend to have sinus congestion, phlegm, if you tend to gain weight easily, you know, and if or your pattern to us shows like a spleen chi deficiency, even raw milk wouldn't be good for you. It would be something you would want to avoid. So it really depends on the person, but in general, you know, I know the Asian diet doesn't have any dairy in it, or very little. So, and I think there's a reason for that. So, you know, I'm not a big fan.
I never even gave that any thought.
Yeah. Well, I like to understand, you know, my father was a scientist, which is kind of ironic, right? So I probably have some of that in me, is whenever I do anything, including something as esoteric as Chinese medicine, I always wanted to understand why I'm doing it. And I always wanted to understand the details behind it.
Well, I know in your office there's a whole binder that I occasionally look through, and it has the research on different ailments.
Yeah, isn't that interesting?
Yes.
Because people still ask me, does that stuff really work? I mean, I get asked that every day. You know, does that acupuncture stuff, does that Chinese medicine stuff really work? You know, and I always chuckle about it because, you know, I've seen the studies from Harvard Medical School, and I've on things like acupuncture. I've seen the studies from Sloan Kettering on Chinese herbal formulas. I've seen the studies from MD Anderson Cancer Center on certain herbal formulas. There's right now for the first time there is a Chinese herbal formula that's in stage 3, the stage 3 of research for passing the FDA for cardiovascular conditions. So, you know, it's funny because when people ask me that, I kind of like, I ask people, I said, do you ask me, you know, does that ibuprofen really work? Or does that antibiotic really work? You know, it's funny that there's kind of a dual standard, but the fact is that I've done all the research on this medicine. I've been practicing it for 20 years. I've had a practice for 10 years. Not only have I seen it in all of my patients and how it works, but I also have done all the research, and that's where that book came from. Thank goodness my associate Bruce Roth, who joined me recently, he's been in practice been practicing for 8 years as well. He helped me to actually compile it so that my patients can see that, you know, we're not making this stuff up. There's science behind it, solid science. And
you have some other things besides the acupuncture that you provide in your office.
That's right.
And I had them, just talking to you, I had them a little bit confused with the cupping and the was it
Moxibustion.
Moxibustion.
Yeah.
Moxibustion, I think just the name intrigues me. Like combustion, moxibustion.
Yes.
Can you tell our viewers a little bit about moxibustion?
Sure, I can.
I bet most of us have never heard of it.
I've never heard of it, yes. And you know, a lot of these things are traditionally used in Chinese medicine. What we've done is we've actually modernized it. So for example, well, let me explain what moxibustion is first. So moxibustion and it was actually, I think, mastered by the Japanese acupuncturists. And what it is it's the use of a specific herb. It's called Artemisia. Artemisia, you actually have it in your backyard and you don't even know it. It's, I'll have to remember the name, but Artemisia grows as a weed. And so it's basically, this herb is dried and cultured and it's ground. And
so that's the only herb that's used in moxibustion?
Mostly, yeah.
Oh, okay.
Yeah, that's 90%. And we use a very high grade, it's dried and cured for 7 years. We get it from Japan, and what it's done is you actually place it on specific acupuncture points. Now, I would like to tell the listeners that, acupuncture is that at acupuncture points have been scientifically proven to have a 2-fold increase in nervous tissue and a 4-fold increase in blood vessels. So the acupuncture points do exist, and these points have a communication process with the body. Well, moxibustion was found that when you take this herb and you put it on a certain point that you're trying to affect, that it that the heat creates an infrared circulatory kind of effect in the body that can affect everything from certain endogenous hormones like opioids, etc., to reduce pain, to strengthen the immune system, to increase white blood cells. So basically, simply put, this herb is placed on a certain point and it's burned. It doesn't hurt. And you don't feel it gets warm, and that's about it. Now, what we've done is we've kind of modernized this in that they actually put on little sticky backing pads that we can put on the points so they stick on. And then we light them and they heat up those points. I've used it a lot on cancer patients that I've treated. I've done a lot of work with cancer patients, complementary and integratedly with their other care. And it's interesting to note that when you do this, you do the moxibustion and acupuncture, that these cancer patients tend, some of them don't lose their hair. Many of them don't have the side effects like the nausea and vomiting, or it's significantly reduced. And one of the side effects of chemotherapy would be things like suppression of your white blood cells, is that we find that doesn't happen, or platelet levels go down during these treatments. It doesn't happen when they get the treatment with us. So moxibustion is critical that I use that with them along with the other things. So moxibustion has been very valuable in my practice. It's great on injuries too, because you can put it on injuries and you can actually restore the circulation to that area and really help it.
So is it like it makes it a stronger point?
Yes. Yeah, it strengthens the treatment. Yeah, it strengthens the treatment.
So not everyone would need that. It would be specifically...
Yeah, I don't use it on everybody. Plus it's got a funny smell. So some people think it smells like the illegal stuff, but which it doesn't. It's not. It's the name is mugwort. Mugwort is mugwort. Okay. That's what they use. Except again, it's a certain. The Japanese one is a certain cultured one that's cured over time. But mugwort grows in your backyard. There's also been studies on using mugwort and moxibustion on certain points, like a point on your toe called bladder 67, which has been clinically proven to turn breech babies.
Ooh.
And that's proven. I've done that in my practice. It's very interesting to see how the baby turns when you heat up the point on the toe. And I did that with my own child when my son was breech, and we were able to get him to turn.
Better than a cesarean.
Well, yeah, better than a cesarean. Yes.
So everything is so fascinating. Now, I think you also wanted to cover what is the definition of health.
Ah, yes. This is critically important, because I find that people don't get care for themselves until they actually think that they have a problem.
Right.
In other words, who if you don't think anything's going on, why would you actually take herbs or do acupuncture or change your diet or go see a naturopath or a chiropractor if you don't think you have a problem?
Right, I feel fine. Why should I?
I feel fine. Why should I? So what I want to do is share with your people that watch this, what are the actual, what does optimal health actually mean? So what I did is I created, and it's in my chapter in the book, is there's 15 points that you can actually self-assess whether you're healthy or not.
So
I know.
people that are
Uh-oh.
listening right now, they can
That's right.
self-assess.
Get out and
And
self-assess.
please do call in. We're talking, but we'd love to have your questions.
That's right. So, so number one is you should lack any symptoms at all, meaning that any symptom means that the body's not functioning right. That means you shouldn't have, this is a women's health book, but it's for men too, but things like PMS, menopause symptoms, hot flashes, body or joint pain, headaches, or if you're on any medication at all, that's a marker that your body's not healthy. That's number one. So there should be a lack of any symptoms.
Right. 5 years ago, I wasn't on any medications, and all of a sudden, I'm on many of them.
All right, well, we're going to get you back. Don't
Yes.
worry. And number two, you should be able to get 7 to 8 hours of unbroken sleep every night. Now, we know that sleep meds are probably one of the top prescribed medications. How many people are getting 7 to 8 hours of unbroken sleep? That's a marker of health. Number three is you should have a high level of energy. I was in my office this morning at 8 o'clock. It's now, I don't know, 8:30, and my energy's still going. People should be able to run 12 hours a day, good positive energy, and feel good. Feel like you did a hard day's work and lay down and go to sleep. Mm-hmm. Number four, having a positive emotional outlook. I find that that's a marker of health. If people tend to feel depressed or anxious or whatnot, it's a marker that your health is not optimal. And you should be socially outgoing. That means being able to communicate and spend time with others is very important. Mm-hmm. That means that you're healthy. Normal thirst, and we talked a little bit about thirst before the show, and we can talk about that. And that's typically in the summer 6 to 7 glasses of fluids a day. And that include, and we can talk a little bit more about that. Normal urination. What's normal urination? Being able to, go to the bathroom 3 to 4 times a day. Mm-hmm. That's normal. Normal bowel movements 1 to 2 a day. Having a normal appetite, meaning that we eat 3 meals a day. I find many of my patients, they say, oh, I don't want to eat breakfast, I'm not hungry. Well, that's a marker. Actually, it's an interesting marker. It's the marker of your cortisol regulation and your adrenal glands. It's a hormone marker if you wake up in the morning and you're not hungry.
Oh, okay.
So that's one of the markers of health. Let's see. Normal sex drive, meaning 1 to 2 times a week.
That's for our listener that called in.
Yeah, and having a normal body temperature, 98.5 to 98.8 degrees, having a normal body temperature is a marker of health. If the temperature tends to go lower than that or higher than that, it means that some of the function of the metabolism may be off. For women, normal menstrual cycle, 26 to 28 days. You'd be surprised at how many women don't have that, and they consider themselves that they have normal, that PMS and cramping and, not being able to go to work and that kind of thing is normal, and it's not normal. It's the body's way of telling us that it's not optimal health. You should be able to perspire when you exercise. A normal resting heart rate, normal breathing rate, and my last thing of 15 points of help is being able to relax and enjoy doing nothing. It's very often that I know that some of the people that I'm working with may not have optimal health when I come into the treatment room and they're sitting there on the edge of the bed going like this, or they're playing with their phones like this obsessively. I know that they can't just settle down and calm and be relaxed.
They bring their phones in?
Sometimes, yes, even though we tell them not to. But you'd be interested, how many people, when you look around, always have to be doing something? Well, it's a marker of good health, both mental and physiologic health, to be able to sit and calmly do nothing. That's a marker of health. So,
I would think one of the big stressors would be the jobs people have.
Well, it's causing that. It's causing that overstimulation, as well as all the technology and all that. I actually have a little...
And also the interpersonal. If you have a supervisor or a boss that's not really pleasant or is always looking to find fault, I think eventually that wears on people.
I agree. It's very stressful, but there's always going to be stressful people in life. We have to confront that. It's funny. In my office, I actually changed the configuration of the waiting room chairs. I put it so that they actually went round, so that people could engage with each other. Because I thought, my thought was that, when you're the kind of person that tries natural medicine, you might think that you're kind of a lone wolf out there doing something outside of the box, and you might feel, I know many times early in my profession, I felt kind of lonely, like, gee, am I the only one that believes in this? Mm-hmm. And so I put the chairs around in a circle because I thought it would be good for people to be able to interact. Uh-huh. You'd be surprised at how many people come in and somebody's sitting there and they won't even make eye contact, and they'll sit down, pull out their phone, and they'll stare at their phone for the 5-10 minutes that they might wait sometimes. And I think that this technology has actually pulled us away a little bit, and now we can't just be calm and not look at our phones and do nothing. But
That's absolutely true, because if you, even in restaurants, I've seen people go out and they're sitting across from each other and they're both on their phones texting someone else.
right.
And I'm
right.
thinking, what's the
What's the
sense?
sense? I actually,
And also with children, I've seen many mothers, they have their kids with them, and
Right.
they're more involved watching their iPad or something
that's
else.
right. And it's interesting because these technologies like iPad, computers, computer games, and TV, they stimulate the dopamine receptors in young children. And dopamine is the overexcitatory stimulator. And so one of the recommendations I always have when I'm dealing with any patient with ADHD or hyperactivity is they've got to limit all of that stuff, because it's going to overstimulate these dopamine receptors. And I think it's happening to adults. That's why we're always so frenetic and, but those 15 markers, what I encourage everybody to do is assess yourself, and if there's anything doesn't fit into those 15 markers, maybe your health is not optimal and it's something you should check out. Doesn't mean you have a disease.
I like to keep up with the news.
Yeah.
And I got to the point where I would start to realize, because they'd say, oh, breaking news, which means
Right.
it's just the new news of the day.
Right.
They don't even cover that much. And I'd watch sometimes 4 or 5 times through, and I would think, why am I watching this? I have already
Right.
watched it.
That's
and I
right.
think what it does, it gets you all built up and nervous, and
Well,
and then
they
I
do
would
that on
think, and I
purpose.
start to think to myself, what am I going to do as a single person?
That's right. You're going to stop the war in Syria or in Iraq
Right.
or in Ukraine. No, we don't.
But I think that's another way of being overstimulated.
I agree. I think being informed is good, but I think again we also have to go back into our own present moment, and we can't allow these things. Stress is a big problem for people's health, because that's really what we're talking about here, right? We're talking about stress.
Right.
Okay. So what is stress? What is stress? It's a person's response to an outside activity. Stress is not internal. Stress is something that we respond to, right? Because why is it some people respond to a situation that's stressful and that they appear as stressful and other people don't? For example, you're driving along and all of a sudden police lights go on behind you, right? You get stressed out. Why? Well, because you perceive that as stressful because you think they're after you. Well, what happens when they pull up and they pass to go on, and your body calms back down? So now you're not stressed. The reality is the stress response in human beings was actually designed as a self-preservation mechanism, meaning that when you're on the, if you're out in the wilds and a bear comes running out of the wood, your body has a stress response to save your life, the fight or flight.
Right.
We were never designed to be stressed out over finances or relationships or the news or whatever it is that we get stressed about. So it's really our response to these non-threatening or non-life-threatening conditions that's causing the stress in our bodies. And so I think the other thing that again, this is all part of our education, is that we have to learn or relearn not to be stimulated by these things that are not going to kill us.
But there are times where something can happen, or someone says something, it doesn't bother me. And other times I take great offense and I become very agitated.
Right. Well, it's part of training the mind. That's why I loved my early training in Tai Chi and Qigong is, in most cases, and of course I'm human, sometimes it's my family that triggers me most, but, outside, you learn to understand that people respond reactively and it's not you. So you have to stay stable and centered.
But do you also think there's something health-wise?
Yes.
That could, because I think sometimes on the medications I've been on, I gradually start to think it has some effect on my personality.
I agree.
No one has said that to me, but I do think it has, because sometimes if I've forgotten to take it or whatever, and I'll start to feel a little differently.
There's
but then
a lot,
I think, well, I have to go ahead and take the
Right.
medicine.
Well, there's a lot of unwanted effects, and I don't call them side effects, they're effects. There's a lot of unwanted effects from medication. I don't think that they fully comprehend what those effects might be. For example, things like...
Oh, they say we have a call, okay.
Oh, sure.
Welcome to Practical Talk Time. Do you have a question for Dr. Ken?
Yes, thank you. Would you please give someone who is not knowledgeable how you would go about starting acupuncture? And
Sure.
how often would that be done?
Well, I don't know other acupuncturists and what they do. I can tell you what I do in my practice, and the first
That would be good.
and the first thing that we really do, and certainly I also want to say that, not all acupuncturists are the same, and not all acupuncturists have the same background. My background may be very different from other people because of the skills and experiences that I've blended into my practice. So this is what I've found, is that the first thing that I do in my practice is I do a complimentary consultation where I sit down with a person, and either me or my associate, and what we do is we assess your health. We assess what it is your goals are, and we assess what it is that you're trying to accomplish, and then we see whether it's something that we can help you with. And I think that that's number one, is the first thing we want to do is we want to assess you and make sure that you're a good candidate for what we do. And once we do that, then what we do is in my practice, what we do is we do an exam. And that exam is designed around, in my practice only, is designed around finding root cause. Meaning that it's important for me to get to the root cause of what's going wrong with your health so that we can then treat you. And then what we do is we do a short course of treatments with acupuncture to start. And that short course, usually depending on the severity of the situation, could be, I've had patients that were in severe pain with spinal stenosis. I saw them, 6 days in a row, 5 days in a row. I have other patients who the problems are not as severe that I might see them every other day. So I usually run a short course of care to make sure that you're a responder, and if you respond to what we do, then we talk about how to, what we might need to do going forward. But in most cases, to start it, the first step is really to do a consultation to find out what it is that you're trying to treat, and make sure that you're going to be a responder, and also make sure that it's, you're in the right place with the right person. I hope that helps.
Is there anything, homework that can be done?
Homework. Yes, you can look up that person's background. You can, by either going to a website that they may have, or you can go to, there's acupuncture.com, where you can get a list of all of the people in your local area, and you can determine whether, based on their backgrounds, whether it's going to fit what it is that you're trying to accomplish, that kind of thing. I also think that, a site like acupuncture.com is good because it'll give you a basic understanding of acupuncture and Chinese medicine. I want everybody who's listening to actually understand, though, that acupuncture is just a tool within the toolbox of the Chinese medical doctor. It's not the whole medicine, it's a component of the medicine. So the person that you go to should not only, number one, I think one of the keys to finding out whether the person's any good, find out whether they feel your pulse and look at your tongue. That is a basic fundamental examination process of Chinese medicine and acupuncture. And if they're not doing that, then they're not practicing the medicine, in my humble opinion. So the first thing you do is you assess that. As far as homework, the more you know about the medicine and what it does, I think the better off you are, and the more educated consumer you are. But I do want to say it is buyer beware, because there's other professions in our state that can practice acupuncture without the proper training, and I'm not going to mention who they are, but unfortunately, there are other professions that are allowed to practice that don't have the kind of background like I do, which is I've been through a 4,000-hour, 4-year specialty medical school for Chinese medicine. And
That's interesting, because I look at the homework as being looking it up on the computer and learning in that sense. It's a big help to someone who's never had acupuncture before.
Yeah.
And we appreciate the information.
Oh, no problem. My pleasure. I can't give my website, can I?
Thank you very much.
My pleasure. Thank you for calling.
Thank you.
Because on my website I have a lot of information. I actually spent about 2 years developing it, and each page that I have has education on it as well, of all these different modalities.
Right, and if they Google Dr. Ken Hoffman,
Kenneth Hoffman, Brookfield, Connecticut, they can find me and they can find our website, or they look up Sophia Natural Health Center. It's sophianaturalhealth.com. There's a lot of education. Again, because I think, this is, for most people like this caller, it's a very it's different. And yes. I think that unless you have, if you're armed with a little education, you may or may not end up in the right place. I oftentimes will have people who've gone to acupuncturists and didn't get good results, or the acupuncturist didn't follow up, or they did one treatment and they didn't get anything out of it, and they wondered why. And the acupuncturist never explained to them that, there's no magic bullets here. We're not a genie. This is a medical process. So I can see how people can get a little bit confused. So I usually look for if it were me, I would look for the person with the most amount of experience, and with the proper credentials. For example, I would go to an acupuncturist to do acupuncture, a chiropractor to do chiropractic, and a Western medical doctor to do Western medicine.
Right.
And I think it's important to go to the person who specializes in what they do. And I think that those are some of the things that I think are important. You wouldn't go to a plumber to get your carpentry done. It's the same idea.
And I know in the beginning of the show that you said you're a doctor of acupuncture in Rhode Island, and the reason is Connecticut doesn't have a licensing.
Right.
for
Yeah,
it.
it's interesting because the training in Chinese medicine in the United States is such that it's the only 4-year professional program that doesn't culminate in a doctorate. It culminates in a master's degree, and each state has decided whether to grant the doctorate license. And therefore, Connecticut didn't do that. Rhode Island did, which is I worked in a practice up there for a year, and so my doctorate is in acupuncture in Rhode Island. But it's important for people to know that in Connecticut, it's a licensed acupuncturist, and I think that's I don't know why that is, because the fact is that we practice as primary care practitioners. Meaning that when I was in school, we were trained, the first 2 years we were trained in Western medicine, and the last 2 years we were trained in East Asian medicine. But that included everything. In other words, we learned to do all of the things generally that a Western medical doctor does other than surgery, but as far as examination is concerned, diagnostics.
Like a general practitioner?
Orthopedic exam,
Oh,
yes.
I didn't realize
Yeah,
that.
absolutely, yeah. Oh, yeah.
I thought it was all just acupuncture and whatever.
No, not at all. At least not the school I went to. And then, for me, but then what you do is you learn to treat these things by diagnosing it based on Chinese medicine. We're using herbs, nutrition, of course acupuncture, and diet and lifestyle modifications. Now, I went a step further in that I wanted to understand more about functional medicine. So I've actually steeped myself in being able to do functional endocrinology, functional blood chemistry analysis, and all of the other things that's maybe more Western, maybe more naturopathic in nature. Do a lot of hormone testing, being able to examine things like salivary hormone tests, because I thought that, again, the blend is important. Be able to read a blood test, to be able to treat it naturally. Most people are bringing in blood tests, so you got to be able to read that. So.
Very interesting. Mary Ann Arena, who's on our crew usually, is vacationing in Utah, so she can't be here. And she works under an osteopath. And because of the blood work, she looks at that, but it has to be prescribed by the doctor.
Right.
And she's really upset that she couldn't be here. But
I love looking at blood work because again, the neat part about Western and Eastern medicine is, for example, I had this just happen the other day. I felt the pulses and I was assessing the patient. And I said, I think that they have a lot of stagnation in their liver pulse, and it seemed like there was a lot of blockage in the liver. And I said, boy, that liver pulse is very tense and very blocked. And then she happened to. Inadvertently, she brought in her blood test, and afterward I looked at the blood test, and the liver enzymes, the ALT and AST, were both elevated. So it was very interesting in how you can assess it through the pulse, but then you have this validation from the blood work. I've also had things like thyroid conditions where you'd be able to assess those through feeling the pulses. It was very, very neat. It's neat to be able to correlate the two. It's fun.
And I used to think the pulse was just for the heartbeat.
Yeah, pulse is just a pulse, right?
Right.
And not to the Chinese doctor. To the Chinese doctor, it tells me all about who you are. I can see whether you're sleeping well. I can see whether you're eating the right foods. I can tell whether you're drinking too much alcohol. I can see whether your energy is good, all just from feeling the pulse. In fact, there's a very ancient story about how, because the Chinese doctors were not allowed to touch the emperor's wives, that the Chinese doctors would tie a string to the woman's wrist and put it through they'd be on the opposite side of a screen. And by feeling the string, he'd be able to assess her pulse. Isn't that fascinating?
It is fascinating.
That's
I did hear that they used to bring dolls to the doctor's office.
Right, that's right. That's true. Yeah.
Do you think, now this is a crazy question maybe, but you know, with voodoo where they put pins in people?
No.
But it's interesting that again they're, you know, the idea of the pins in the body.
Right. Well, that was actually training method. Is that some of the ancient training method? When the Chinese doctor in training, they actually had bronze statues that they found that all of the thousands of acupuncture points were on the body. They were little holes, and what they would do is cover these bronze statues in clay. And in order for the Chinese doctor to get his degree to be able to practice, he had to be able to stick the needle through the clay into the holes. In other words, you wouldn't be able to see the hole, but he would have to be so accurate that he would have to get it right into that hole.
Oh, I thought maybe there were only hundreds. There's thousands?
Thousands of points on the body. Mm-hmm.
So there's no way that you could have all those thousands memorized?
No, there's different systems. In school, we're actually required, and by our national certification exam, to memorize at minimum 365 points. Now, as you go through practice, you learn multiple other points, but there's many in the body. Yeah.
So the more you practice, the better you get. That's why it's always a practice.
That's right. The more you practice, the better you get. That's right. You know, people always ask me, like, they'll come to me and they'll say, "Well, how come your acupuncture doesn't hurt?" I'll say, "Well, you know, 18,000 treatments makes a big difference. I've done 18,000 treatments, and there's a big difference between that and somebody who's right out of school." Trust me.
Well, it's not supposed to hurt.
No, not at all. And you know, it's adapted to the person. No, acupuncture doesn't hurt. You know, you might feel a little pinch sometimes, but other than that, it should be pretty comfortable.
I remember the first time I saw it, I went to a holistic fair, and there was a woman that was on a table with all the needles in her, and I went to her and I said, "Does that hurt?" And she said, "No." And I looked at it and I thought, "Oh."
You said, "Yeah, I know."
And I actually won a free treatment that there's only 1 minute left, so I don't have time to talk about
okay.
that. But it was
Wow.
interesting. And I did
hour,
try.
Huh?
Very fast, and I hope more people would have called in.
That's okay.
But I think they're interested in listening too, and they can find out more information by Googling your name, or they can also contact us at practicaltalktime@yahoo.com, and if they have any comments or questions, we can forward them to you or any of our other guests.
Thank you.
And thank you very much. And we'd
Thank
like
you.
to have you on with Usha
Sure.
Kumar, our producer. She knows about something about the Hindu Ayurvedic methods.
Yeah, and
it'd be nice to have a
they
conversation.
shared a lot of time. They shared time together on the Silk Roads.
Right, and then I think she said there's something that she saw on your website or somewhere that she knew was Ayurvedic.
Oh, okay.
And I didn't know that.
Yes.
And so we have to wrap it up, and we look forward to having you back again.
This was awesome. Thank you for having me.
And also when you get your new book done.
I will. I'll be back on
Okay.
then.
And to our viewers, we'd like to say thank you very much for watching. We hope you've enjoyed this very informative program. And we do hope to have Dr. Ken Hoffman back again. And maybe Dr. Bruce would like to come along too at some point. And if you have any questions, again, email us at practicaltalktime@yahoo.com. Good night.